Yeah, hello, I need a doctor.
So, how's the temperature been?
Up at night when I'm not freezing to death.
You've been having chills?
Yeah, and then fever and sweating.
Juliet, 4 nights is a long time to feel this bad without seeing a doctor. All right, let me just pop this in your ear. Yes, cheers up a bit.
I went to the chemist 2 days ago. Because I got sick so quickly, he said that I had food poisoning.
Did he give you anything? Antispasmodic?
He said to drink plenty of fluids. I didn't want to call a doctor out unless I really needed to. I bet you've had a busy night.
Well, started off slow enough, but I've been paying for it since 3. You been vomiting?
A little, not much. I feel like it, but then nothing happens. The worst thing is my stomach. I can't get comfortable. No matter how I sit or lie, I can't get comfortable, and my back's really sore.
Whereabouts?
Yeah.
How's your stomach feeling now?
It's not excruciating, but it's tender.
And the tenderness is low down as well, is it?
Yeah.
What time is it?
5:20.
You're not still worrying about Dr. Carlyle?
I can't help it. I know what she'll do.
Does she have to do anything?
She could report me to Mac. I'm not supposed to sleep with patients.
I'm sorry, Faith.
Don't apologise. I knew what I was doing. I wanted to.
Good.
Why did she have to walk in at that moment?
Yes, your stomach's definitely a bit distended. How have your periods been?
Regular.
Nothing heavy or abnormal in any way?
No, not really.
No, you haven't missed any?
No.
No. Any trouble going to the loo?
None. Although with not eating very much over the last few days.
Yes, sure. Any trouble passing water?
That's fine.
Any pain during intercourse?
No. No pain.
Well, the symptoms vary so much.
Do you know what's wrong with me?
I can say with confidence you haven't got food poisoning. I think there's a strong possibility you have a pelvic infection.
What?
You are sexually active, I take it?
Yes, but...
But?
Dr. Elliot, I've been in a 9-year relationship. A happy, loving relationship.
There hasn't been anyone else in that time?
Hard as it may seem to believe.
You think your partner could have...
No, never.
Well, I don't know what you know about pelvic inflammatory disease.
Not much. It can make you sterile.
It can do, if it's left untreated. It can also lead to ectopic pregnancy and chronic pain. A sexually transmitted disease is usually responsible, most commonly chlamydia. Unfortunately, most women don't show any symptoms and they only discover they have it when their partner shows signs, or until they go for a routine screening. Chlamydia can go undiagnosed for years, although I'll be honest with you, and so I've never heard of it going back 9 years without causing any problems. Chlamydia affects the reproductive organs and the surrounding tissues, and inflammation causes scarring and adhesions, and the damaged tissues become susceptible to other bacteria. Now, I'm going to start you off on a high dose of antibiotics, and I'll give you something for the pain as well. But I want you to come into the surgery later today for tests, all right?
All right.
When does your partner get back?
Why?
Well, you're in no fit state to come in on your own, really, are you?
Oh, lunchtime today.
Good, good. I want you to take these 2 now, and I've given you a prescription for the rest. But if you have any problems, you give me a call. All right. Good. I'll see myself out. Juliet, I think it might be an idea if we tested your partner as well, just to be on the safe side. But we can discuss that when you come in. Goodbye.
What's on your mind, Mac?
Nothing.
I know you, Brendan Maguire.
I was wondering how Billy's getting on.
Well, thanks to you, he's at home playing with his baby instead of being in jail.
He deserved a break.
And you got him one.
He gave me a lot more than I ever gave him.
For instance,
The idea that I might have more to offer than just a medical degree. Look, you study hard, you qualify, you come out knowing a bit about this and a bit about that. You can write prescriptions and make referrals, and if you're really clever, or lucky, you manage to match the right pill with the right ailment without actually killing anybody. Not getting involved, though, is it? I mean, you're helping people, sure, but... See that Billy episode? Maybe there is more I can do.
well, like what?
Well, talk to people like me. You know, people for whom one drink is too many and 20 isn't enough.
Counselling.
Well, why not? Rehabilitation clinic? Day centres? I don't know. With my limited experience, tell it like it is.
And what you've achieved over the last 6 months.
Yeah, that too.
Morning, Mrs. Ryder.
Good morning, Dr. Carlyle. Oh, you look tired.
Do I?
That's where I'm blessed. I always sleep well.
Not surprised.
Do you know, my mother always used to say, to tell a woman she looks tired is to tell a woman she looks old.
Oh, what was she, a diplomat?
No, a seamstress.
Is Mac in yet?
Since 8 o'clock.
No, I don't mind what I do. Yes, anything. Yes, sure I could. Yeah, well, I might have some free time later on today. Yeah, well, I could pop in, couldn't I?
Jude, I like Jerry.
Obviously.
He makes me laugh.
He's a patient, Faith. You don't sleep with patients.
You don't set out to, but it happens.
Not if you're professional. Bedside manner means bedside, not between the sheets.
Please don't say anything. Please don't mention this to the others. Jude! He makes me laugh. I haven't laughed in a while.
Hello, this is Juliet Barry. Just to let you know I won't be coming in again today. I'm really sorry to do this to you, but I still feel dreadful. A doctor came out a few hours ago. I had to call the emergency doctor. He started me on some antibiotics. So, hopefully, they'll kick in soon.
And he's due for a win, especially as it's been so dry lately. And the dry is unstoppable, so my friend tells me.
Oh, hi, Mark. A busy night, I see.
Oh, tell me about it. I had one cold, one bout of flu, one child with earache who'd had it all the day before. Need I continue?
I've been there, done that.
All right, Mark. Here's something to cheer you up.
Listen to this.
Last night I went out for a drink with a sports reporter from our paper, and she's given me the racing tip of the century.
Oh, century. What is it, 3 years?
No, listen to him.
Look, here. Devil Boy, that's the horse. My reporter friend tells me he's a dead cert. Devil Boy on the nose in the first. Now, the faint-hearted might like to go for a place, but the smart money's on a win.
And by what means did this friend of yours deduce that Devil Boy is it?
Yeah, Deborah Boy.
By what means did they deduce that Devil Boy is a dead cert?
A little inside information?
I'm afraid I'm going to have a bit more than that, Ollie, if you want my cash.
Yeah, me too.
Well, let's just say she likes short men.
Ah.
Hello, I don't get it.
she's having an affair with the jockey, Ben.
A rather torrid one, so she informs me.
Yeah, pillow talk, Kate. All right.
On the nose, Ollie.
On the nose.
Do you think he wears his silks to bed?
Juliet? 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 Juliet, what's wrong? I saw your car outside. Are you sick? I'm so glad to see you. You should have called me. I would have come straight back. It's okay. The doctor came this morning. He gave me some pills. That's lovely. You should have told me last night. I didn't want to spoil your big dinner. How did it go? We did a deal. The project's going ahead. That's why I didn't tell you. What am I going to do with you? Love me. I think that's already been arranged. So what did the doctor say? What did he say?
Oliver, something you want to tell me?
I don't understand.
You realise that as GP registrar, you are answerable to me, as your trainer.
Yes, of course, mate.
So why does everybody know about it except me?
About what, Mac?
Devil boy in the 2 o'clock.
Oh.
Come in, Mr. Huxley.
Mrs. Ryder said you had a few moments to spare. Mr. Huxley isn't here yet.
Sorry, he's a bit deaf. What's up?
It's about a friend of mine.
Uh-huh.
Last night, she rang me asking for my advice. She's in a bit of a bind.
Oh, dear.
It's a work thing, really.
Right.
My friend works in a job where she has access to a lot of personal information about her clients. A job where she's in a position of trust.
I see.
Well, one of her work colleagues did something to breach this position. Something she just should not have done.
Was a crime committed?
No, no crime. But this person's conduct was unprofessional and could compromise employee-client confidentiality. My friend's in a quandary because
She doesn't know whether to report her colleague to her boss or not.
Yes. Anyway, I've been mulling it over and I can't decide what to tell her to do. She and her colleague are good mates.
Be that as it may, it's a clear-cut issue. The client's interests come first.
You're saying report it?
Absolutely. What was your friend's name again?
That's impossible. That's what I said to the doctor. Pelvic inflammatory disease. Well, we don't fool around. We're not part of this scene. We couldn't be more monogamous. Could we? Are you asking me? Sorry. I'll do the doctor a favour and have a shower before I see him. There are times I've wondered. Well, I've seen the way women and men have tried to hit on you. You're a beautiful girl, Juliet.
Mrs. Ryder, I'm just slipping out for a minute. Back in 10.
This Devil boy, is he really a dead cert?
You betcha.
Right. That's a tenner on the nose, then. There's a good boy.
I thought you could do with this. Oh, I don't think I could drink it. I'll leave it just in case. Thank you. Here. Let me help. Do you know, I used to try and get my mother to brush my hair to 100.
You know, like the old wives' tale.
Did she?
She managed 3 laundrettes and a nappy wash service. It was enough she remembered to feed us.
I can do it. I won't make 100. Dr. Elliot told me that chlamydia can stay in the body for years.
9 years?
I don't know.
10 years. You were going out with Frank then. Mi chiamo Sally.
Mi chiamo Juliet.
Piacere, bella signora. Italian class.
Yeah.
Vive sola?
No, I live with my boyfriend.
And this boyfriend, do you love him?
No, not anymore.
Qual è il suo numero di telefono?
I gave you my telephone number. I'm surprised you remember so much.
Yeah, well, I studied hard. I was out to impress.
You did. Enough for me to meet you for a drink without the rest of the class.
I was surprised you agreed.
No, you weren't.
I wasn't.
I was hooked.
Well, you can never be sure.
Have it your way. You saw the effect. Anyway, denial takes up too much effort.
Yeah.
Come in.
Hi. You haven't told anyone?
About you and your patient? No.
Thanks.
Not yet, anyway.
Jude?
I don't want to.
Good.
But Faith, you haven't left me with any choice, have you?
And we have sessions throughout the day. Of course, all our counsellors are fully trained, specialising in alcohol dependency.
So what can I do?
6 months is it you've been sober?
Yeah, 6 months.
We'd say that's still too soon to give advice to others. Let's face it, Dr. Maguire, you're still facing your own demons, aren't you?
Yeah, I guess so.
You're still vulnerable, but someone like you would be invaluable as a speaker, talking about your experience, how the treatment has helped you, how you're coping now. You'd always be welcome at our meetings, and I know social services and hospital groups would also be interested. We've found that someone who is recently sober can sometimes be more inspiring to people trying to stop drinking than someone who's been sober for a long time. They can relate more to the immediate future, and their aims seem more realistic and achievable.
Yeah, that makes sense.
And we drop the doctor bit. It's your experience as someone overcoming an addiction that's relevant. If people are aware that you're a doctor, it could complicate things. They could see your role differently, as counsellor, advisor. That wouldn't help you or them. No, we'll leave off the doctor bit, Mr. Maguire.
How about Mac?
How did we do? Did you see the race?
Yeah, I watched it in the betting shop.
So what happened?
Well, how did it go, Ollie?
Good, you're back. How's our horse?
Oh, we lost. We lost everything.
What?
No way.
I warned Dr. Berg about the evils of gambling. I told him.
And I told you it was a dead cert.
Oh, what the news!
Oh, Dr. Berg! So, what time's the next race?
It was only last week. I was thinking we should have registered. We don't normally get sick, do we?
No.
Just the usual cold or cough.
Sal, you pull over, please.
You can be sick. Are you all right?
It was 2 years ago. I didn't mean for it to happen. You were away a lot. I was stupid.
What?
He was on attachment from head office for 3 months. He was friendly and gentle and oozing with charm, loads of charm. He was always making a play for me.
You had an affair?
Oh, I'm sorry.
You had an affair with a man?
Doesn't matter who it was with. I let you down.
How could you do that to me?
I don't know. I think about it all the time. I don't know where my head was or what I was thinking. Maybe I was curious. I can't explain.
Well, that's pathetic.
Yeah. If it's any consolation, I'm paying for it now.
So am I.
Yes? Here, let me help. Come on. You should have come in earlier. Where's your partner?
Here. Dr. Elliot, I'm Sally Mawson.
Ah, I see. All right, just make yourself as comfy as you can. That's right. Her condition's a lot worse than what I saw earlier this morning.
Juliet?
Me chiamo Juliet.
Italian.
Yeah, we learnt it together. It's how we met.
Right, look, I'm going to have to examine Juliet, so if you wouldn't mind stepping outside.
She told me it's pelvic inflammatory disease.
Well, looking at her now, her condition's deteriorated so rapidly, I would say something much more serious is happening. And now I know your situation.
Situation?
Your lifestyle.
Being gay, you mean?
This kind of sexually transmitted problem is a lot less common in gay women. I mean, it's not impossible, of course, but it does make my earlier diagnosis less likely.
I'll be outside.
Yes, thank you. All right. I'm just going to touch your stomach.
Oh!
All right, it hurts there.
Yes.
And that side?
Oh!
Juliet, I believe you have developed peritonitis. That's inflammation of the membranes in the abdomen. It's a very dangerous condition. It could be caused by pelvic inflammatory disease, or it could be caused by a ruptured appendix. You didn't appear to be that ill this morning, and that's why I didn't consider it.
If only you knew.
Sorry?
What you'd done.
Yes, ambulance, please. I'm Dr. Elliot from Riverside Surgery. I have an emergency, possible peritonitis. I need an ambulance straight away. Thank you. Goodbye. Miss Mawson. Take a seat.
I'm okay.
Juliet is gravely ill. I believe she has developed peritonitis. There's an ambulance on its way.
Peritonitis? Well, not pelvic inflammatory.
Well, it could be a complication of pelvic inflammatory disease or a ruptured appendix. I'm afraid Juliet's been a lot more ill than I first thought. Could you just excuse me a moment?
The affair, it may have had nothing to do with my illness.
What a pity you didn't find out sooner, because then your secret would have been safe. I wonder when you were going to tell me.
So when there was no answer, I went to look for Mr. Walsh, and I found him in the bedroom. In bed with Faith. Look, I really didn't want to say anything. I really like Faith, but...
No, you did the right thing coming to me. It's a difficult situation, and I think we should all have the opportunity to respond to it.
What was this guy like?
Well, I can't say he's not attractive. He used to be a firefighter. Hero type. I can imagine it was a temptation.
But it's the ethical issues that are raised that's a problem. Medical staff can't get involved with patients. There's a code of behaviour that has to be honoured.
As much for our sake as for the patients.
But come on, Faith's a good nurse. It's not like anything like this has ever happened before.
And it won't be happening again.
Well, can't we make allowances? I'm sure she hasn't had an easy time lately.
Mac, I'm talking about her professional conduct, not personal.
I started her off on antibiotics. Have you got them here?
Yes. Here they are.
Thank you. There we go. That's it then. All right, you better step on it.
Sal?
Sally, Juliet's in a really bad way. Please don't make it any worse than it already is.
I'm wondering if we should take official action.
Is that an option?
Kate, everybody makes mistakes.
A bit of sympathy wouldn't go amiss.
Oh, please. The two of you both know that there are boundaries, guidelines.
Unfair as they may seem sometimes.
Quite frankly, I'm beginning to question Faith's state of mind.
Well, if you feel that way, cut some slack. Give some time to work things through.
Yeah, good move.
I'd certainly be happy with that.
Giving Faith some time off to work things out would be a good idea.
What if she doesn't want time off?
Well, this practice can't revolve around what Faith wants. I mean, for a start, we're going to have to remove Jerry Walsh from Riverside's books, transfer him to another surgery. We're going to have to insist that Faith takes leave in order to rethink her position.
You can't do that.
She does have rights as an employee. I don't think we can.
Yes, we can. I'm sorry, but the way Faith has been carrying on, we have to decide whether we're prepared to put up with her behaviour. And she has to decide whether she wants to be here at all.